In the midst of a national conversation about the quality of health care, people with intellectual and developmental disabilities are left out. The neglect of this community has history. From the 1850s to the 1980s, people with intellectual and developmental disabilities were often institutionalized. Conditions were described in many cases as horrific.
My background and experience came from having a brother who was a person with a profound intellectual disability, who had been in a state-operated facility for many, many years and was abused badly in the facility to the point they blinded him. They removed his corneas for donations, I learned later on.
People with intellectual and developmental disabilities now usually live with their families or in community-based home-like settings. Although conditions and treatment have drastically improved since the days of institutions, quality person-centered health care is a known problem. Rush University Medical Center and Georgetown University Center for Excellence in Developmental Disabilities are two organizations leading efforts for change in the healthcare system. To illuminate the issues and programs around healthcare for disabilities, we gathered input from patients and self-advocates with intellectual and developmental disabilities, along with family members and healthcare personnel, to give an overall perspective on this topic. In Washington, D.C., a regional coalition of self-advocates and self-advocacy groups was formed, called Project Action.
When a doctor sees you, I would like to know, do they know about a disability person?
My experience is, especially going to the emergency room and try to get care or what have you, they could be really short with you, especially if you got a learning disability.
Like in some of the comments that people made, for an example, like someone said, well, someone came in my office and they screamed and hollered or whatever else and scared off all of my patients, all of my good patients. And I was like, okay, so what did you do? And so basically he made the person leave. And I'm like, okay, did you ever think that person might have been afraid? It wasn't a familiar place for this person. Like I was like, so your only thought was to just make the person leave. So that person didn't get seen that day. That person could have had a toothache and maybe that's why that person was screaming. It could have been something going on and you just told that person to leave.
I've seen both really great doctors who listen and take the time to talk to people. And I've seen doctors who absolutely disregard that this person that they're taking care of is really a person.
And I hope the medical field realize that a lot of times when we have a chance for somebody to treat us with respect and treat us with decency, a lot of times the only time we have a chance for that is when we with them, is when we with the nurses, when we with the doctors. You see, we don't get that on a day-to-day basis.
Being a patient anywhere in the world is difficult. Trying to be understood, trying to get the help that you need is a challenge for all people. Patients with intellectual disabilities have an even steeper challenge to be heard and for their needs to be met.
An organization that facilitates the practice of valuing, respecting, honoring, and supporting individuals with intellectual disability first has some kind of vision around what it means. The language has to be there. It has to be as inclusive as possible. Next, it has to be backed up with policy.
You have to be ready to deal with these individuals and deal with them in a way that respects their autonomy, respects them as a person, but also accomplishes the institution's goals.
We really do need culturally competent care, and we really do need something that's person and family centered.
Rush University Medical Center and the Georgetown University Center for Excellence in Developmental Disabilities have designed policies that have been implemented through specific programs. The programs are designed to improve the overall treatment of persons with disabilities and are meant to provide ethical quality care and financial improvement for healthcare institutions.
At Rush University Medical Center, we have very targeted programs to deal with patients with intellectual disabilities that go from just our care plans and daily management all the way down to respite times where students will come in and just play games with people to try to alleviate the pressure off of both the patient as well as the care team. We find these targeted programs develop amazing results that are felt by both the staff and patients as well.
What are our values, our guiding values and beliefs? Be able to sit down and knock that out and make sure that it trickles from the top down and the bottom back up.
At Rush, the Adults with Intellectual and Developmental Disabilities Committee formed after conversations with employees. Over more than 10 years, it has overseen developing programs to implement these policies.
This group got started in 2007 following a town hall meeting with the CEO, Dr. Goodman. At that town hall meeting, a patient care technician from neurology said that they had a number of adult patients with intellectual disabilities coming to the unit, but really didn't know how to take care of them. And in fashion of many medical centers, a committee was formed.
Rush has done a marvelous job of spearheading improving services for people with intellectual disabilities.
One way to develop a culture of respect in which these programs can be implemented is through diversity hiring initiatives.
One of the values of Rush really actively recruiting people with all kinds of disabilities is that the more people who work at Rush and hiring managers see people with the various types of disabilities, the more they realize how positive it can be. It's just something that makes us a great place to work and a great place to go for healthcare.
I'm a transportation tech guy. I work on the hospital side.
I work in the College of Health Science.
I just love waking up every morning, coming into work, get to come out here every day. I get to walk around each and single rooms. Man, I love this job.
One of the benefits of having employees with intellectual disabilities is it shows that this is a workplace where they know how to make people successful in doing their jobs. And I think also that there are many people that have family members with intellectual disabilities or have intellectual disabilities themselves. And when they come into a healthcare facility and they see that there's other people whose story they relate to, I think they feel more connected to that place. I hope that they see it as a place that they can trust because they know that they're hiring people from, throughout the community.
In order to get the care that patients with intellectual and developmental disabilities deserve, it is commonly accepted that standards of care and protocols need to be established. One of the protocols that Rush nursing, faculty, and students established was the development of care plans in their electronic medical records. To get this information into the daily workflow of nurses, they developed a visual tool called All About Me.
There is information about developing an individualized plan of care, as part of the nursing care model.
Each nurse, I have to explain how they like their medications, to how the lights need to be in the rooms, what their bedtime is, their medication schedule, things like that. I was like, why don't we develop a tool that can sort of go through some of those things?
Myself and another colleague of mine are working to get this tool implemented into the nurse's workflow.
The goal is, how do we make sure that that is a living, working, breathing document?
Studies have confirmed that recognizing the importance of sensory needs is key in providing person-centered care.
This isn't the most tasteful story, but this gentleman was smearing his hands with feces. And it turned out that all he wanted was to smell something on his hands, and they used essential oils, rosemary one day, then thyme, then lavender, and each day they gave him a new scent to smell, and it prevented him from smearing his hands with something else that would be less wanted.
Often people with autism spectrum disorder, you have to be very aware of managing sensory conditions. Many of these individuals have a unique focus on maintaining certain levels of sensations, or may have specific sensitivities around sound, around taste, around light, around touch.
Most healthcare professional programs provide little or no education and training in working with persons with intellectual and developmental disabilities.
Some of it depends on doctors, which don't know us. And sometimes, depending on who you bring in the room, if you bring a provider in the room with you, then the nurse and the provider get together and you're left out.
That's one of the troubles when you go to see somebody, especially you have your aide with you. They much rather talk to your aide than you.
Lots of medical professionals don't always have a lot of background or don't have a lot of knowledge about individuals with intellectual disability.
At Rush, being immersed in a culture of respect that honors the inherent value of people with disabilities has encouraged students to get involved in their own training. Students developed a volunteer organization, the Neurodiversity Allies, to be involved directly with patients and through these relationships improve their own ability to provide respectful, patient-centered care.
This one student nurse came in and we went down to get some tests done and we played tic-tac-toe, but I beat her.
Neurodiversity Allies, along with some of the other programs that are really putting students in with patients, has done a great job. When we're in the classroom, we're getting a list of symptoms and you're memorizing those, and it's not always as easy while you're sitting listening to a lecture, really connecting that to the person. So I think even though we're not providing care within Neurodiversity Allies and you're really just there as a companion, it really puts in some perspective of, I'm learning about this, but this is how it applies to the person and the individual.
Basically, our aim is to enhance the hospital stay experience for individuals with intellectual disabilities.
It is widely accepted that attention to sensory awareness is important for medical personnel to carry out standards of care. But it is now being understood that this awareness is vital for all staff. Rush has implemented training for their security in an effort to build allies in improving care.
Well, the reason that we requested to have this training is because we've had seen an increased population of patients with autism come to our emergency room. And our major concern was how the officers were responding to patients with autism.
Well, the project is really basically teaching autism awareness and recognition of different behavioral characteristics with individuals with autism, and how to mitigate any potential crises that may arise as they come into particularly the ED environment, which can be overstimulating for this population, could cause an increase in anxiety.
Implementing standards of care in emergency and acute settings requires quick access to key health information, including sensory needs. For access to this key information, a portable health record was created.
Someone goes into an emergency room, and it's an emergency. Now, the doctors, the nurses, have to know where to look for what they need at that moment.
In starting from before the health passports, the large binders were our only source of information. After the development of the health passport and the pilot, we didn't need a pilot because it was almost immediate that this was going to be transformative. When you have someone coming in who has multiple medical problems, you are going to have to make an assessment based on that historical data, and it's all in 3 pages, along with their medications, both current as well as discontinued, their allergies, their immunizations. If they do have someone who is part of their support team or their guardian, that's all there, very well laid out.
And it is a comprehensive, short blueprint of an individual, a specific individual, and how that individual communicates. What makes that individual comfortable? What makes that individual scared?
Now, the next iteration is going to be the electronic component of that, having that available electronically, and then having some interoperability that extends across the different sectors.
While these resources and other efforts are making a difference, there is evidence to show that placing attention to persons' experiences post-hospital stay, an often overlooked step, can play a significant role in preventing unnecessary rehospitalizations.
I work with individuals who are hospitalized, and I'm usually notified either by telephone or email about the hospitalization. Depending on the severity of the hospitalization, I do go to the hospitals and I meet with the physicians, the nurses, and the case management staff working to discharge the individual. Once the person is discharged, I do follow up with that individual in the home, just to ensure that the person has followed up with their primary care physician, has scheduled or seen a specialist if recommended, taken the medications that they're prescribed at discharge, and also that there has been training from the nursing staff to the direct support staff who are serving them to make sure they have that education and training about the hospitalization and what it's going to take to help decrease the number of readmissions in the hospital.
Once persons return home or to community-based settings, it is important that nurses involved in their care be prepared to meet their needs.
My job is as nurse educator. We have health and wellness standards, and I reach out to developmental disabilities nurses, and I provide all of that training for them, telling them what the health and wellness standards are and what they're expected to meet.
To keep unnecessary hospital admissions down, it is important that direct support paraprofessional staff in the community have training on recognizing signs and symptoms that need to be reported so that patients can receive care as soon as possible.
We train them what to look for, what to report, when to report it.
Working with the community to come up with solutions has proven to have positive outcomes.
Our advocates need to get out there more, I think, and spread a message and to talk to people and to tell people, like we deserve this and we should have all types of health and wellness services that everyone else gets. We deserve it as well. We have a great group of advocates here in the city, and they speak a lot about what they deserve around healthcare.
Healthcare institutions are recognizing that they have responsibility in the treatment of patients with intellectual disabilities.
Recognizing that there's an increasing number of patients with intellectual disabilities in the United States of America, I believe it's incumbent on all our institutions to develop targeted programs to provide an unmet need for comfort as well as a better patient experience for this group of patients.
We don't look to stand still. No, none of us want to stand still. We all want to be better and better and better as the years go by. They have to get it. They have to understand that that word is not just a word, it's an action word. You got to put in action. Go Project Action! Go Project Action! Go Project Action! Go Project Action!